All right, thank you. Appreciate it.
Hi, I just want to drop off this mask to you guys. So I have, I think it's 400 regular masks and then 20 dessert N95 masks.
That's so cool. Thank you so much. We definitely recognize that there's a national shortage of masks, and we're trying to be, as conservative as possible. As you can see, we're wearing surgical masks and not N95s, given current CDC guidelines, and just recognizing that we're saving those N95 masks for those treating physicians that are treating the COVID-19 patients themselves in direct contact and actually doing the swabs, for example. So we're trying to, maintain our supply as well as increase our supply. So thank you so much. Appreciate it.
I think how it started was Supervisor Haney had a press conference and asked Tina to translate, and from that conference she learned that there is a great shortage of masks, and that kind of started us to get those.
We represent workers who home care workers who take care of people with disabilities or senior at their own home. Also, we representing long-term care workers of nursing home. We are there participating and addressing the needs of home care workers that really need the protection. They're serving people with disabilities and seniors at their own home, which is really the high vulnerable populations that might be affected by the coronavirus. Right now, they're totally out of masks, and we are trying to get the donations. If the workers willing to buy the protective gear for themselves to protect themselves as well as workers, there's not everything is out of the store shelf. So we are desperately need particular on the mask. We have about a dozen workers who test positive, mostly on the nursing home, and then also the resident of the nursing home that have test positive.
How many of those?
About 60.
60.
Yeah. And then we also have a home health care client who receive home care service. 2 of them has been diagnosed, and 1 unfortunately passed away. The other is in ICU. Thank you.
There you go.
We are so grateful of organizations bringing in masks like we just experienced today. 6,000 surgical masks goes a long way for us. For the surgical masks that we got today, we can go through 1,500 to 2,000 of those daily, right? And for N95s, we go through 300 to 400 of those daily, depending on how many COVID patients we have that we need to take care of. Currently, we have 18 COVID patients in the house. 6 of them are in ICU, and 5 of them are vented.
There's a big need for this, and we haven't even hit the surge yet for the COVID. According to our county health, they don't know the exact date, but it's supposedly in San Mateo County, it'll probably be in May. Because we've done pretty well in our county as of flattening the line by social distancing, which is the #1, and we've been shelter in place, and because our ordinances are pretty tight, that we've been able to stay below the number of what was anticipated. I mean, anytime someone passes from this, it's horrible. But the numbers were not what we expected, and we're hoping that we can continue that. People are putting their lives at risk and their families at risk and can't go home and are scared to go home. And these nurses should not feel that way. So for me, the supplies are key to keeping them alive because they're keeping everybody else alive.
We are getting supplies daily, but I'm not the one in charge of it. But we do have enough for today to be able to take care of our patients today.
Today? What about like the next
Probably the next couple of days for sure. But this is ever evolving and it's changing every day. But for now, we do have enough to take care of ourselves and our patients. But I mean, that's not to say that that won't change. We have been very fortunate that in our city that the mayor did act more quickly than other places. And I think that has definitely helped our situation that we are not in the same dire straits that New York City.
How many coronavirus patients are there right now diagnosed?
Currently, we're in an orange status, so we have. So this is PPE. We're going to urgent care.
Come on, Tina.
How many coronavirus?
My understanding is that we have about 39 cases right now.